Neck pain, arm pain, hand pain, finger pain, really common, very debilitating. Let's cover in this video today a little bit about the basic anatomy of the neck, and then let's have a look and discover on an x-ray what a normal neck should look like and what one looks like that is starting to wear out and the implications of that. So let's have a look at it. I'm Michael Bloom, chiropractor. So looking at your neck from the back here, this is the neck from the back. From the side, there should be an arc to your neck, That arc's really important because it helps the weight of your head be well distributed by the shape of your neck. If you can imagine, your head is heavy relative to the small bones of the neck. Think of it like this, a silly analogy. It's like a bowling ball being held on top of a toothpick. So really, to carry the weight of your head, the neck bones, they need to be shaped in a very efficient, ergonomic manner with that arc. And when we have that arc, then we have a much better chance over the duration of our normal lifespan of having a well-functioning neck and less likelihood of neck pain, headaches, shoulder pain, arm pain, hand pain, all of those associated potential symptoms that can come from the neck. So let's have a look at how an x-ray would look when it looks the way it should with a smooth arc versus when it's lost some of that shape and also some of the impact of that loss of shape. Let's go have a look. So looking at this x-ray here, this is an x-ray of a well-shaped neck. So we can see the 7 individual neck vertebrae. 1, 2, 3, 4, 5, 6, 7. And this is the back of the head, and these are some fillings in the front of the inner teeth. So that shape through the neck there is going to be able to hold the weight of the head in a much more effective manner than if we'd lost some of the shape of that neck. What you can also see is that there are spaces between each of the vertebrae. Between 2 and 3, you can see a darker space, 3 and 4, 4 and 5. That is where the disc is. So that is where in the case of a model of a spine, the disc is, the cartilage between the vertebrae. So well evenly spaced discs and a smooth arc is exactly what you want to see in a well-shaped neck. In this example of a neck, as you can see, it's lost the shape. It has lost that smooth arc shape. And now we've got a straight configuration angled forward. These are the fillings in the teeth and the skull. So we've lost the curve through the neck. That means that the weight of the head has been positioned more forward in a downwards direction. The weight of our head is more forward of the bones of the neck. So over an extended period of time, the heavy head weight has come through in an angle and a direction which is very difficult for those small bones to hold. Now, you can notice that through looking at the discs. When you look at the disc space here, it looks well spaced. That one looks quite well spaced. This one looks reasonably well spaced. This one and this one are significantly narrowed. You can almost see that there's no space through these bottom areas here of the neck. What you can also see, if I zoom in, pinch in a little deeper, is you can see that there's a little angulation backwards on some of those bones, which is getting into a space. So it's getting into a space backwards here where the spinal cord runs. So it's reducing space through there. Now this is at the base of the neck. So in an area of your neck which is impacting nerves which come into the shoulders, arms, hands and fingers. So it's much more likely someone in this situation is going to be feeling some symptoms in their arms, hands, fingers area. Not always, but very commonly. Even in a situation like this, it's very possible that some assistance can be provided, some manual assistance to help someone live better with this. But really, this is a deterioration that has been taking place over at least a decade, in my experience, to get like this. A decade of poor posture just building slowly and steadily and losing that shape, and therefore through the weight of the head being distributed heavily through these joints here, starting to lose the disc space. This is a typical osteoarthritic neck or spondylosis. So these are the common terms you'll hear with an x-ray report that looks like this: spondylosis, osteoarthritis, degeneration. Those three types of, those three words really describing the same thing. But hope is not lost. There still can be something done in the majority of cases to assist with living a more comfortable life. Thank you for watching. I hope that those examples that you could see on the screen of a normally shaped neck and one that has some degeneration make sense to you. If you have any questions, please put them into the comments and I'll do my best to get to them and answer them. And I hope that in whatever state and condition you are, that moving forward, you move into a more healthy direction. I wish you all the best for that. Thank you for watching. Cheers.